The QEH Pulse radio show is brought to you with the kind compliments of MedSafe Medical Supplies.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Pleasant good morning to you, listening to us here on Q100.7 FM for the relaunch Season 3, the Pulse Radio Show. Yes, we're back with you from the Queen Elizabeth Hospital. It's your show where you can call us, of course, and we'll share the numbers with you in short order and share your experience about what you experience at the hospital and share what you would like to see at your Queen Elizabeth Hospital. I'm your host, Shane Seeley. Always a pleasure to be with you on a Monday morning at 11 a.m. on your favorite station, Q100.7 FM. We have so much to talk about. Of course, we were off from since Christmas. We hope that you had a wonderful season and a happy new year. And we will also be talking about the season very shortly, because we are seeing the results of that at our hospital. We have been giving you a lot of advice. Last season, we spent a lot of time talking about the new strategy for the hospital over 2025 to 2028. We are in that year where we are starting to see some action as far as the strategy is concerned. That strategy is led by our Chief Executive Officer, Neil Clark, supported by our Chief Operations Officer, Dr. Christine Greenidge, and the directors and the entire staff at the Queen Elizabeth Hospital, who are there to serve you, the general public, as you come through. Now, speaking about coming through the hospital, let me start with some notices, because a lot of things are happening at the hospital right now. The ophthalmology clinic, which is often very busy daily, that has been temporarily relocated. It's been relocated to Ward B2. This is because of some essential maintenance work which is to be carried out in the existing department in the Lions Eye Care Center. We want to maintain that safe and comfortable environment for all patients and visitors as they come in, so we'll be performing some necessary cleaning of the air conditioning that's there, the ceiling as well, and surrounding areas. That will happen over this week, from the 10th to the 14th. So the ophthalmology clinic would have concluded operations by midday on Friday. Patients will now be seen in B2. You should have received a call to let you know if your appointments would be changed, and we will resume operations from the original ophthalmology clinic that's in the Lions Eye Care Center from Tuesday, February the 18th. If you have any questions, or if you know that you were to have an appointment this week and you haven't received a call, you can call this number, 228-1958. That's 228-1958. Our staff will be very, very willing to help you as far as that appointment is concerned. And if you have any further questions, and there's a number that is a bit easier to remember, it's our patient advice and liaison service. That's 536-4800. 536-4800. And the reason why you may remember that one better is because that's the number I've been preaching for the first 2 seasons of the Pulse Radio Show. That of our help desk, which you call, when there's a surge and you want to know if you should come to the accident and emergency or not. That's the number that I've been advising you to call, and we'll talk a bit more about that. But as always, I have some of my friendly colleagues here to share a lot of information with you. So let me introduce our head of accident and emergency, Dr. Anne-Marie Cruickshank. Good to have you back on this season 3. How are you doing this morning, Dr. Cruickshank?
I'm doing relatively well, Shane. Thank you very much.
Relatively well because she's been relatively busy every day of the week for the past few weeks. We'll get into why she's so busy. And also back with us, I know you remember this face because she started the show with me, Dr. Rhea Corbin-Harte, our head of patient relations. Of course, she runs that help desk as well. She manages the help desk. So she's the manager of patient relations at our hospital. Dr. Corbin-Harte, great to have you back as well.
Thank you so much. Always a pleasure to be here, for sure.
Yes, so let's start with you, Dr. Cruickshank. Everyone is always interested in the operations of accident and emergency. We've expanded, but that doesn't mean that the demand hasn't been coming to our doors. Maybe we should start just alone by giving people a snapshot of this weekend, and then we could go back a bit to when we were speaking about that surge, and just to give an example of what you see and what you've been seeing week in, week out.
Okay, so this weekend, as usual, we had trauma in the A&E, and we had gunshot victims and stab victims. Obviously, this puts strain on our resources because obviously we have other serious patients that need help. So the constant violence that we see presenting to the A&E, it really affects the staff and the patients, obviously, because they've been waiting to be seen by the doctors, and the doctors now have to run to the resuscitation room to deal with the immediate needs of stab victims and gunshot wound victims.
Yes, and as is standard operating procedure with some of these situations, A&E was on lockdown for a few hours. We have been having some great collaboration with the police collaborating with our security department to ensure that everyone feels comfortable while we are experiencing our doctors and nurses treat to these victims. So the police presence is always very good, making everyone at the hospital feel safe. Now, that is just a snapshot, really, of what you have been experiencing over the last 2 months, Dr. Cruickshank. We had that surge where we put out the notice to let people know things were a bit busy. And again, I said this on Friday on Morning Barbados. I have been saying this from the time that I came into the position as communication specialist. We're not telling you not to come to our hospital. It is your hospital. If you feel you have an emergency, you should come. But we do advise that if you're not that serious, and we'll get into that because that can be a gray area for some people. They may not know if my condition is as serious as I believe it is. And that's why we have the patient advice and liaison service. But we had that notice. We sent it out to the public, letting them know that there's a surge in patients in the A&E. There are alternative options for medical assessment.
Yes. Yeah, so going back a little bit, Christmas was relatively quiet in the A&E, and we welcomed that break.
That was a difference.
Yes. We were actually keeping up with the patients. We were having good waiting times. Patients were being seen relatively quickly. We had beds on the wards. We were doing well, and we welcomed that break. As soon as January came and Christmas shopping and Christmas preparations were finished, persons remembered they were...
There's one thing you forgot there. Christmas eating.
Christmas eating,
and Christmas
correct.
Bad habits.
Right. So as soon as that settled, patients remembered they were sick, and then we got the surge in January. And we had an increase in the number of patients to be seen, and we then began having the pressure on our resources.
Right. I heard Dr. Ford on Friday mention as well what you're seeing in A&E, which may be a lot of uncontrolled NCDs. Yes, influenza, but people not following the regime prescribed by their physician.
Yes, absolutely. We've seen an influx in respiratory tract infections, and we know influenza is on the rise. And we've also seen the complications of persons with the NCDs not complying with their medications during Christmas, not following their treatment plan set out by their medical practitioner. So we're now seeing the complications now coming to the A&E of the uncontrolled diabetes, the uncontrolled hypertension, and the heart failures and the renal patients. So we're getting all that now coming to us in January and the beginning of February.
So what is it like now?
Today is not too bad, but we've had surges last week with the number of admissions to go to the ward. And we had to have an incident command meeting to make a plan on how to deal with that. So it can move from increased number of patients to be seen or the increased number of admissions to go to the ward.
Yes, and we are going to help those of you who are unsure if you should come or if you should seek alternative options for medical assessment. We're going to tell you how you can make those decisions, better judgment calls, because in season 3 is all about promoting how you manage your health. Your health should be your top priority, and you need to better manage your health. So the Queen Elizabeth Hospital, we want to play a supporting role in helping you manage your health. And that's where the patient advice and liaison service comes in. I know we have some callers on the line. I didn't even give the number yet. Those numbers you can call: 4341007, 4341070, and 4341007 is the number that you can WhatsApp us at. You know, if you want to send some information to us, because we want to hear those complaints as well. Many of you have had good experiences, but we want to hear the not so good experiences as well so that we can address them. And that is something I'll talk about a little later in the show. We do have a first caller before we go to Dr. Corbin-Harte, our manager of patient relations. Welcome, caller, to season 3 of the Pulse Radio Show. How can we help? Good morning, caller. Good morning, caller. How can we help?
Peace be unto you, your sins.
Thank you very much.
To the staff and all listeners. I would like to say something. I have someone that was at the hospital. I don't know if you always call it triage. Triage is when you waiting on results.
But no, triage is when, you know, you come to the hospital.
Yes.
We want to assess your situation.
Right.
That's one of the first points of contact.
Anyhow, the person was there for 2 days and had to go for another appointment, but had to beg to let them come home to clean themselves and change their clothes. And I was thinking the bathroom, you can't do it in the bathroom because, you know, the bathroom would y'all probably ain't planning for that, but I was suggesting those persons who could get up and like assist themselves or the family could assist them to get a bath if you wouldn't think about, you know, putting some place there where these people could think, or he had to beg them to let him come home. So, and the other appointment was compulsory. He had to go. So that is my suggestion. Y'all could think about that. I know some person was telling me about that they didn't plan for you, they didn't plan to stay so long, but how long people down there waiting to either get to a ward or probably they can't come back home not till the doctor make sure that everything is okay. So that is my suggestion.
We thank you for that suggestion. I'll let Dr. Cruickshank speak to this, and then Dr. Corbin-Harte in terms of how patients can help to manage how they operate within our system. Dr. Cruickshank, you want to respond to this?
So I'm not clear what the call is saying, because I know for certain we have shower facilities in the A&E. We have shower.
And this is since the expansion.
Since the renovated A&E has come on stream, we have showers in the observation unit. We have showers in the decontam isolation room. We have showers in the isolation unit, and we have showers in the treatment area, which is the new expansion.
Right.
So I'm not certain if the staff didn't tell this patient that
Right.
we have shower facilities for patients who have to stay with us, because, as you know, the patients are actively being seen. They're waiting for results, they're waiting to see the specialties, they're waiting for admission. So yes, you can spend 2 days in the A&E, but you're actively being managed by either the A&E staff or the specialties.
So why this person did notify that they could get a shower there?
I'm not certain,
Yes.
ma'am. I think that might have
Because
been an oversight.
if I knew there were showers, I would never call to ask. I mean,
Understood.
to say anything.
Understood.
And that's
Right.
why we are here.
Yes.
You know, so
Right.
that when we get these complaints, that we can share,
Right,
because
but the person didn't know they had to come home. So
yeah,
that's why I said whenever I hear you again, I can ask if there isn't any there. So thank you for that. And I guess people now would know then
exactly.
that there are, and they will ask the staff then to allow them to either go and clean up themselves, or maybe the family, help
Yes.
them clean themselves up. Well, I'm glad for that day, because I was saying that probably they didn't have any. But thank you.
That is not a problem, and we thank you for calling so that we can alert the public about some of the things we may not have. And it's
Okay.
always good to inform people about things they may not know.
Right,
It's all
well,
about
I'm
that
glad.
learning experience.
Right, I'm glad about that.
You're welcome. You're welcome.
All right, have a blessed week, and everybody stay safe.
Thank you very much, and thank you for calling. Happy Valentine's in advance.
Same to you, but my Valentine is John 3:16. For God so loved the world that He gave His only begotten Son, that whosoever believeth in Him shall not perish but have everlasting life. Nobody is perfect, and we always fail each other. So I ain't got no Valentine.
I love that.
Just my children,
I love
our
that.
friends, and family.
I
but
love
they're
that.
they're too failure at times,
No,
So
man.
the only body that you can trust is on the everlasting Creator.
As you said,
Thank you.
none of us
Huh?
are perfect. None of
Right.
us are perfect. So
No.
we accept, and we try to do our best. But we
True.
thank you for calling and sharing your story.
All right, thank you.
Yes, because it's helped us to educate people about what has happened now with the expanded wing in
Right.
accident and emergency. You have a
Okay.
great day.
Thank you. You too.
Yeah, so thank you, caller, for that. It's all about the learning experience. So people are going to learn more about the expanded wing of accident and emergency, and about other parts of our hospital in season 3 on the Pulse Radio Show, and how the hospital supports your journey to better health care. Dr. Corbin-Harte has been a very important part of that journey, and speaking about that, I don't know how many of you would have seen it over the weekend. It should be still there. Barbados today would have published our 60th anniversary feature showcasing the service of the Queen Elizabeth Hospital to the community over 6 decades. It's a great read. Please go check it out. A lot of beautiful pictures from the past. We're looking at what is happening now, and of course we're looking to the future as we continue to improve what's happening at our hospital. Some new equipment coming into A&E as well. We'll talk about that in short order. But a beautiful face in Dr. Corbin-Harte's when she was talking about her journey through COVID and being a part of the management of the facility up north. But beyond that, she's been dealing with our patients, and a number of them calling in through the patient advice and liaison service. That has become very important for us in, I would almost say, a part of triage.
Yes, indeed. It is a part of everything, mainly education and helping our patients and public and our relatives of our patients to be able to navigate through the healthcare system and navigate their own health. Because healthcare is not easy. It's not a one-stop shop. It's not a one and done. It is a continuous. Static. It's not static. There are many facets to it. You go here for this, there for that. Do this if that, do that if this. And we understand it can be very complicated. And as such, as you rightly mentioned, our patient advice and liaison service desk, long words, stands for PALS. It's your hospital pal. We are here to help you through your time with us at the hospital, and also to be able to answer queries that are health related. It does not have to be directly hospital related, but it can be health related, because we know it can be complicated. And definitely a shout out to the staff of the help desk, very adept in their knowledge, and very willing to help the patients. You know, we do have doctors, we have nurses, and we have paramedical staff as well that man that desk from 7 a.m. to 7 p.m. Monday through Sunday, but not bank holidays. What kind of questions can you ask? As I said, anything health related. If and when we're having a surge in the accident and emergency, and we mention those cases that are not as serious, you know, maybe better to seek alternative care. We don't want to say don't come. We're not saying don't come, not in any means. But what we're saying is, you may be better treated or a bit more quickly treated at other places. How will you know if your case is serious? We can help. That's where your hospital PAL comes in, or PAL's help desk. You can call, have a discussion with the agent on duty, air your concern about your illness, and then based on the information, they will be able to assist you with the direction of how you should navigate healthcare. Should you still come to accident and emergency, or would this be better handled in primary care, such as our private doctors or our polyclinic system?
And I know you said agent. That agent is a medical professional.
Yes, a medical professional or a paramedical professional, but definitely someone who is versed on the healthcare system on a whole, and also the healthcare system within the hospital, and who can render advice on how to navigate those systems. And in the event that it is outside of their purview, they at least know where to direct you, or where to get the detailed information that you may need to be able to navigate the system.
So you can even call in the event that that medical official on the line believes that this person may be in severe distress, can call an ambulance and for them?
We don't directly call the ambulance for the person, but we can assist with letting you know this is the number to call, this is why we think you should call. You know, if you don't get through, reach out to me again, because the ambulance system, they will need information directly from the caller. Indeed. And it will always be more efficient for that to be a one-on-one conversation. But we do have persons that sometimes they need the encouragement and the explanation as to why their medical concern is one that should be seen in the accident and emergency, and the agents are able to talk to them in that regard. Now, they may come, and it may be deemed after investigation and time spent in the accident and emergency that your case was not an emergent case. You may not need to be admitted. It may be treated with medications, IV or what's not. That can take time, yes, and it may turn out that you are able to go home. However, the only way that it would have been known that you could go home or that it isn't emergent was if you were seen, assessed, investigated, stabilized, yes, all of those things that Dr. Cruickshank speaks of. And those are things that do take time. As she explained, sometimes it can take up to 2 days, but it is 2 days of being actively worked on. Right. I look at it as when you're painting your house for Christmas, you don't snap your fingers and the color of the house changes. It takes about 2 days to a week for the painters to come in and do their assessment, see what it needs. It's a process, and that's what happens in the accident and emergency. And we are here as the PALS desk to explain that to you and to help you be able to navigate it and understand it.
Yeah, we even want to take that PALS desk a bit further very soon. We're exploring some new options. Just let me give you those numbers to call us here on the Pulse Radio Show if you have any questions, concerns, complaints, or compliments. 434-1007 or 434-1070. You can also WhatsApp us right here on the Pulse Radio Show at 434-1007. We'll take a quick break and be right back here with you on the third season of the Pulse Radio Show.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmett's Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Welcome back to the Pulse Radio Show, of course, sponsored by MedSafe Medical Supplies. We thank them for signing on the show for a third season. Go and check them out on Gemmett's Lane. They have a great catalog and great supplies on offer for anyone with medical conditions. Go check them out, MedSafe Medical Supplies. We got a WhatsApp coming in. Blessed good morning, Shane and our doctors. Shane, do you all look at making the gunshot victims pay the kind of money for their cure, because it's using up our resources that should be given to persons who really need it? I think they should pay something towards their gunshot wounds. We thank you for that opinion. We treat everyone coming into the accident and emergency department, our doctors, our nurses, our medical teams, treat and do as best as they can to manage the entire patient population coming through their doors. We can't discriminate.
No.
We can't discriminate. They have a job to save a life. They've made a pact in terms of being doctors to do that, to save lives and to do their best to...
No prejudice.
Exactly. We got 2 calls on the line, so let's go to the first one. Welcome to the Pulse Radio Show Season 3. How can we help?
Hello.
Hi, good morning. Welcome to the Pulse Radio Show.
Hi, good morning, sir.
Good morning.
I'm calling seeking for my help, right? It's not that I am calling to bombast or anything, right? My point is, I was a brain surgery. This is 3 years I'm being diagnosed, and I'm waiting on QEH for that operation. I was being admitted in 2022. I spent like 3 months in the hospital, every day being canceled, my surgery being canceled. When I being canceled now, I had 1 clinic appointment. I went to the clinic. Then the doctor said me don't make a clinic appointment. I been calling the doctor, private office, complaining of when you blowing a balloon, the compress that you're getting in my head, pains, no response. When I come to QEH to get to see the doctor, they tell me I cannot see him because I haven't seen a long time. I have to go to a private doctor to get a referral back to QEH. I don't know why it's that. Anyway, I did not. I sent a friend of mine. She said, at least, she said, we're not going to give up. She keep going, constantly keep canceling, putting her aside, and all kinds of me getting this appointment. Okay, I did get one the 7th of this month. What hurt me is that when
that is Friday.
The 7th of January, sorry, the 7th of January.
Oh, last month. Mm-hmm.
Yeah. Okay, I went and I go. When I go, there was a doctor that come from overseas said that, okay, he willing to do my operation. I was like, thank God, because it's 3 years, and I lost my vision in my left. I am a single parent, and things is getting downhill for me. I pushed so much to get all my medicals done, not working, with a little help, get the MRI, get all the things done. Get a disc, and so forth, to the QH on time for the doctor to pay attention to me.
Right.
When I called back, one of the nurses told me that they told the doctor there's a disc there for them to look at, and they said okay. For me, I did not feel that is what the doctor said, because the nurse called me back and said, come back for your medical and come back and collect your results.
Yeah, so you had a breakdown in communication generally, and what I would like you to do is call our patient advice and liaison service and give this report. We want to investigate this situation, and we want to take some urgent action on it. So you know the number, 536-4800?
Honest with you, as I said, the left eye, I cannot see nothing.
Mm-hmm.
The right is only 25%. And
Understood.
as a single parent, I can't really see small print to right, and it's hurting me.
I understand.
I keep reaching out. I'm not saying I'm an illegal immigrant. I am a Barbadian. I'm a Kelman. I'm a related. I'm a Barbadian citizen, and it's hurting me.
Right. So I understand that you are in some severe pain, and we want to help. And we want to help by letting you have your situation investigated as soon as possible. So the way that we can do that is having you call 536-4800. That's our patient.
You gotta hold on for me. I don't have no one here to write that number.
And what you can do too is before you go off the line, we can let the producer take your details so that we can reach out to you.
Yeah.
So I think that would be the faster option.
Yeah,
let the producer take your details.
I don't have to write the number.
That is okay, but we will get to you. Let the producer take your details so that we can get back to you as soon as possible and investigate this situation. But we thank you for sharing with us, because we want to respond to situations like these and others that will pop up right here on the Pulse Radio Show and otherwise. That's why we ask people to call 536-4800. But we will get that information and follow up very shortly, and you will hear from us. Okay? Thank you for calling. We have another caller here on the Pulse Radio Show. Good morning. Welcome to the Pulse. What's your question, comment, or share your story with us? Good morning.
Good morning. I'm calling to ask a question. My son went there last week, Thursday, for an appointment to get a CT scan done. When he get there, the nurse or I think the clerk or somebody tell him he's supposed to get blood taken. So I was querying it. So I want to know what the procedure, because he have to go to surgery the 18th of this month.
18th of February.
Yes, please.
So this sounds like a case for pals. We are here to help you through the process. There are some CTs that require you to have a blood test to make sure that your kidneys are working well prior to getting the CAT scan done, because we don't want to cause any harm, and the contrast can affect the kidneys if they're not in good working order. So I suspect that may be the kind of CT that she's speaking of, but of course we like to hear details so that we can better advise. So definitely
he was stabbed right. So it was something that put in there. So the doctor say it is just a procedure that just gonna take out what them put in just to remove it.
Right. So when I say details, I do mean specific things that we may need to ask you to be able to better direct you. So our 536-4800 PALS number would be able to sit with you and discuss the process, look at the test that the request forms you have, to be able to best direct you on the order in which you need to do things, the things you need to have done, because we don't want that he is unable to get his surgery on his surgery day because of maybe missing tests that the doctors need. So
but the doctor
if you can please
say to get a test done, she just write out the paper and the appointment and just tell him to go and get it done.
Right. So we can. So yes, but there's sometimes you still need blood tests done, because we don't want to cause any harm to him. You know, for every action there can be a reaction. So we want to do our checks and balances. So if you call our 536-4800 number, they would be able to, you know, we utilize technology. So they may ask you to send a photo of the request form if you have one. Just trying to investigate exactly what you need, so they can point you in exactly what you need to do to get these things done correctly.
Okay, another question. I would like to say thanks to Dr. Yat and her team and the staff on Ward A2, the surgical ward. Thanks a lot for helping me with my son.
You're very welcome. We'll be sure to let Dr. Yap and her team know, and the staff on Ward, did you say A2? A2. We thank you so much to the staff, always hardworking, definitely changing lives every day, and we do appreciate the staff for that. You're welcome.
Thank you.
Yeah, Dr. Yap will be on the show in a few weeks' time, so you can listen out for her and tell her, give her the kudos yourself. But thanks for calling and sharing with us. Remember to call that 536-4800 number, and you as well, you can, if you want, you have the option of leaving your details with our producer so that we can have them and we can reach out to you as well. Okay? Alright, let's take another break. Of course, the Pulse Radio Show is sponsored by MedSafe Medical Supplies, located on Gemmitts Lane, St. Michael.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmitts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.
Back with you on the Pulse Radio Show. A number of callers trying to get some information about their various appointments and situations with their relatives at the hospital. And that's why we have been giving you the number for the PALS Help Desk, 536-4800. We got so many other things to discuss, but before we get there, we do have another caller. Welcome to the Pulse Radio Show.
Good morning.
Hi, good morning. How are you doing? Happy Valentine's. Hope you're doing well.
Thank you. Thank you very much. Same to you. Yes, please. And the panel, good morning.
Good morning.
I don't understand how a patient who has a heart condition, blood arteries all around, because they were in the hospital.
Mm-hmm.
So when they came out, then they were told they were given appointments to go back. You're gone on back to the hospital to your appointment. They can't find your notes. No problem. They gave two more weeks or so to come back. You're gone on back home. You crawl back out because you're sick. Gone back again. Can't find your notes. No problem. You're gone on back home. Another 2 weeks or 3 weeks pass. The day come back. When you get there, the doctor ain't in today. Well, I can't understand this, Mr. Seeley.
These things can happen. And we do apologize for that experience. You may have heard the CEO, our Director of Support Services as well. That's Mr. Neil Clark is our CEO, and then Miss Louise Bob, she is the Director of Support Services, talk about the health information system which is coming. You know, when that comes, when that is online and on stream, we wouldn't have that problem anymore of missing notes. For now, it's a paper-based system, and sometimes with the number of patients who exist in that system at the hospital, missing notes is a situation that can happen. Again, we do apologize for it, but again, and that's why I have been saying here on this show from season 1 to this season, call 536-4800, because then we would have a little advance notice and have those medical record clerks, have those officials in medical records do a bit of a deep dive for those notes, so that by the time you get there, we know that we would have those notes in hand. It's a proactive measure, and we are trying to get our patients, our visitors, and the public in general have a more proactive approach to taking care of their health. This is one mechanism that can help. You call 536-4800 in advance of that date that you're supposed to come to the hospital. You've had an issue with missing notes before, so you're calling in advance to ensure that, do you have my notes this time around? What do I need to do to have that note ready when I come there? So you call it in advance of that second visit, because you mentioned the person would have, I don't know if it was you or a relative, would have come there twice missing notes, and then the third time the doctor wasn't there. So in advance of the next visit, I urge you to call 536-4800 and explain that, so that we can have our records clerks do a bit of a deeper dive. Let's find those notes and make sure that you're seen as you're supposed to be, or the relative is seen as they're supposed to be.
And if I may add quickly,
Dr. Corbin-Harte has something to add to that. Some more advice for you.
Yes, in the event that you are out of medication, you may need to get more, so don't wait until just before your next visit. But if you're out of medication, do try to call us today or tomorrow, so that we can try to arrange that you can have your prescription done, so that you are not without medication while you await seeing the doctor. And I think that's an important part, not just for this lady, but in general. Your medication usually lasts until your next visit. So if for some reason your next visit does not happen and you're out of medication, we can try to help so that you don't go without medication for a long time.
Yes. Okay. I thank you all for your all advice and so on.
You got the number?
Yeah, especially the number. I thank you for.
Yeah, but I want to know if you got the number. You got it?
I got it, and if I didn't know that before, I would have called ahead for that person.
Yeah.
That's why we're here today, to share this information.
I apologize for us being missing over just after Christmas into January, but we're just getting things organized so that we can come back to the public holistically and offer some assistance and advice moving forward as we really try to make some changes at the Queen Elizabeth Hospital.
Another thing, I hear the list for surgery, for heart surgery, is very long. I want one to speed it. They want speed it for this person. I don't want to lose them yet. So you have a good day, sir.
Working on it. I'll speak to Mr. Harris, the Director of Medical Services. I know that he is working hard to cut down on these lists to ensure that all of our patients are seen in a timely manner. We know that there are some that have not been seen in a timely manner. We apologize for that, but we are working to address it.
All right, sir. Thank you. Have a good day.
You're welcome. And for those of you, our medication delivery service has been doing some great numbers. We really want to thank Deborah Allen and Trudy Griffith for the work that they've been doing in the pharmacy. And just to give you an idea of the type of work that has been done by the medication delivery service alone, trying to pull up these numbers here. I know it was like the average is something like 76 orders per day, which is great. 76 orders a day
delivered.
Yes, and the total number for January was 1,599, just short of 1,600 deliveries for the month of January. We always advise that, don't wait till your medication is on the final day to call. Please call 536-4804. So, the patient advice and liaison service pals, your help desk, your hospital pal, that's 536-4800. And you can call that too for your medication delivery sometimes. But you can also call 536-4804 between Monday and Friday from 9 a.m. to 3 p.m. to place your order. It's best that you do it 7 days in advance, or at least 3 to 5 business days. 3 to 5 business days prior to the start date of the repeat medication. But the early bird catches the worm. So please remember those numbers to call: 536-4800 for PALS Help Desk, and for our medication delivery service, 536-4804. A pleasant good morning to all of the pharmacy team who have been working hard. We see the lines sometimes in that area when you come through the main entrance by the pharmacy, but we've been getting some reductions through the medication delivery service, and we want to make it convenient for our patients. We got another caller on the Pulse Radio Show. Welcome to the show, caller. How are you doing this morning? And again, I'm going to tell everyone for the next few days, happy Valentine's. How are you doing? What's your question, comment, complaint, or compliment? Good morning, caller.
Really good morning to you.
Hi, good morning.
And to the medical staff there. I am very aware that the staff of A&E are working in an extremely stressful area. With the upsurge in shootings and serious accidents and incidents and deaths that are occurring and they're having to deal with in A&E, is there any system in place for regular counseling services for the A&E staff of all levels so that their psychological and emotional well-being is maintained?
Right. So what we normally do when we have a traumatic event in the A&E, we would immediately do a debriefing session. And we tend to do that online because the staff of the A&E is very big. There are at least 150 persons that work in the A&E with different staff groupings. So when we have to do a debriefing, we would do that online, and we would have counselors from network services that come in to assist us to do debriefing and to help with counseling with the patients. With the staff, I should say. If, however, a staff member continues to have challenges with whatever has occurred, you can then do a one-on-one with the counselor at network services, and that's provided by the HR department of the hospital. So we have that service provided. And then we also have, when we have the traumatic event, Canon Burke is our regular, he's the priest in charge of the hospital.
A resident chaplain.
Right, resident chaplain. And we also have Reverend Leacock, who also helps on the oncology ward. So we have both of those services where we can ask Canon Burke to come in and speak to the staff after the event has occurred. And Canon Burke is always willing to come and assist and speak to the staff to help us with the debriefing. So that's one of the resources that we use with these sort of traumatic events and other types of traumatic events, death of a child, motor vehicle accidents, anything like that that affects the staff. We try to assist with their emotional well-being.
Okay, thank you so much.
You're very welcome.
Because I am well aware that having been a medical person and nursing myself, when you experience traumatic stuff, it is important for you to have a vent, a place where you can express yourself, because if these things are not dealt with, it can have bad effects, not only for the department, but for the persons who are working there in their home life in the communities, and it can have a real big spin-off effect. So I'm very pleased to hear that there are regular counseling sessions available, and that staff know where they can reach and who they can reach out to in the event that they're feeling overwhelmed or adversely affected.
Yeah,
Thank you so much.
And Carl, I want to thank you for remembering the staff, during these periods. People think about when they're coming in, dealing with their situation, and that is totally understandable because, you want to be dealt with. But it's good that we can hear some of the callers remember the great work that the staff is doing, that they may need help in some instances when they're seeing these traumatic events. But also to understand, I want to salute you, Dr. Cruickshank, and the entire team there for dealing with these events unfazed and just getting through with it and trying to move from patient to patient. It can't be easy seeing those people coming in and having to deal with them as quickly as possible, because every second, you can save a life. Yes. Every second. And that's some great work by you and your team, Dr. Cruickshank, and we really thank you for your service over the past few years. We know it has been difficult, and we know it has consumed your time every single day. Yes, I want to tell the caller, thank you so much for considering the staff of the A&E. A lot of people don't realize that we are just human beings too, and sometimes we are the walking wounded, because we are helping, but we need help too sometimes, because we are tired, we are burnt out, we need to eat, we need to rest, but we still come back and we still turn up every day. So thank you so much for, being concerned about the emotional well-being of the staff of the A&E. We appreciate that.
Yes, thank you. I'm very concerned, I guess, of all levels, because when I look at the situation, I realize that there are a lot of young people working in A&E. They may not have a big lot of life experience.
Yes.
And especially those who come in to clean and so on. Even them, they need to be included, because it is not easy having to deal with the blood and the whatever that needs to be dealt with. And when we consider that Barbados is just a little village, everybody knows somebody who knows somebody. And when these incidences occur, somehow we are impacted. A lot of people are impacted in personal ways because of our compactness and our small size, and QEH being the only emergency hospital, available quickly for the public. And I am concerned. I am praying. I continually hold the hospital and staff, especially the A&E people, up in my prayer, And we regularly pray for you in my church.
Thank you so much.
Because we know, we are aware of your, the depth at which people go to provide care, and we so appreciate it, and we want it to continue in a vein where the staff is well cared for so that they can well care for the public.
Thank you.
Thank you very much, caller, for sharing and for your prayers, really, for the team at the QEH, and especially in accident and emergency. They will continue to serve as best they can. I know that they're committed to the task at hand, and sometimes, yes, you have to wait a bit longer than you would like, but these workers go through a lot, and we really want to thank them for their service to Barbados and to all patients who come through AED, because we know that they do some life-saving work. The results are not always positive.
And may God continue to bless all of you.
Yeah, thank you. Just a reality check. The results aren't always positive, but I'm telling you, from the time you come through the door, we are aiming for a positive result. We have a WhatsApp message here, and it's along the same lines. Blessed good morning to you, the team here. I am one of the silent supporters of things happening or that has happened at the hospital. I was attending the QE8 since 1978. 20 years later, unfortunately, I was diagnosed with an underlying incurable illness. I was treated by a beautiful team of doctors, too numerous to mention, and like your last caller said, I only had one problem with missing notes. Thank you for that comment. We're looking to improve the services in the accident and emergency department. Dr. Cruickshank, we're getting some new equipment, and we're also looking at some virtual things, but let's talk about the new equipment first.
Yes, so we have been blessed to have a CT scan now in the A&E. It has been finalized. Engineering has done a lot of hard work to get it set up, and we're now this week starting applications and training of the radiographers from the radiology department. So very soon, we hope before the end of the month, the CAT scan will be operational in the A&E. We've never had a CAT scan in the A&E before, and this has been a kind donation to the hospital and to the A&E department. So we're looking forward to that. We're hoping with this CAT scan we can decrease the time to imaging in terms of getting your CAT scans. We know we're starting off slowly. We won't be able to cover the 24-hour shifts in the A&E. We'll continue to use the main radiology department to assist us with the CAT scan, but we think it will improve the time taken for the imaging. So we're happy about that.
Wonderful. Great news. And of course some x-ray rooms. All of this is a part of the expansion of the accident and emergency department, really trying to decrease the time that patients have to wait for imaging. So that is some good news coming your way. As Dr. Cruickshank said, we're hoping to operationalize this by the end of February. So happy Valentine's as far as that is concerned. We got another WhatsApp here. Let me take a quick look. Right, so no, that was the same WhatsApp. We thank that person for the message. We do have another call on the line. Welcome to the Pulse Radio Show. What's your question, comment, and thank you for calling. Happy Valentine's.
Happy Valentine to you, Mr. Seeley and guests. Hello?
Hi, we're listening. We're listening to you.
Yes, happy Valentine to you all, and nice hearing you all also. And I'm a member or a patient at QEH, and I had an appointment with my eyes before COVID. Since COVID, I haven't been back. So when the last time I saw the eye doctor, I was told that I had very young cataracts. So recently my eyes have been getting cloudier. I don't drive at night anymore, and sometimes I have to use a magnifying glass to read. So I would like to make another appointment, but what have me so skeptical is because when you go, I have had that experience before, when you go, like say you have a date this month and you go this month to put you back like all in July or so, but I I really want to have my eyes checked. Can you tell me the procedures, please?
Sure, and we want you to be able to have your eyes checked. So this is what we speak about when it comes to primary care and tertiary care. Our hospital is tertiary, which is number 3, primary care number 1. So how it works is that your general physician or general doctor or family doctor or polyclinic doctor, whatever name you use, they need to be your first point of contact to evaluate you and do the primary evaluation to see, is it something that can be treated in primary care, or is it something that, yes, needs to be escalated to tertiary care at the hospital? So that's what we speak about in terms of referrals. So making appointments, you don't come directly to the hospital. You see your family doctor, and this is not just with eyes. This is literally how a healthcare system works. You see your family doctor, they evaluate the situation, figure out, is this something that we can deal with in primary care, and then refer to the hospital if it needs to be referred. And it might be that your cataracts have grown, yes, but we never know, it might be something else as well. So your first stop would be your polyclinic or your family doctor. Air your concern, they will examine you, and then they will refer to the hospital if necessary.
So before I go any further, suppose I had an appointment there before, but I didn't keep it.
Yes. So
I was going there before, but I haven't kept it because of COVID.
Yes, so there's still a cutoff because things may have changed. You know, things may have changed in terms of your medical condition. So it's still always best, once you've missed it and it has been years, it is still best to be evaluated by your primary doctor, because there may be now additional factors that may be contributing to what you're experiencing, and those additional factors may be treatable in the primary care facilities. So once you've missed an appointment and it has been a long time, so you know, if you miss your appointment this week and you call and say, well, I missed my appointment last week, can I have a new date? We can always reschedule you. But once it's been a long time, we need to have that evaluation, because as you rightfully said, sometimes persons get appointments very far ahead, and that's because of the volume of patients. So we want to make sure that those persons who can be helped in primary care are helped in primary care more quickly, and only those who need to be in tertiary care, which is the hospital, are helped at the hospital. That way everyone gets seen a bit faster.
Okay,
I hope that helps. So I do believe you will need to start at your primary doctor, polyclinic, or your
that's just like another 2 months or 3 months or so.
Well, no, it depends on how fast you move, and it
depends on what is wrong.
Exactly, you know. So you can make that appointment go to the polyclinic, or make the appointment at the your doctor as soon as possible. And if the referral is critical, they will definitely make that referral as soon as possible for the hospital. And if you have any other questions about the process, call 536-4800 so that our medical team there can help to guide you so you can get this treatment sooner rather than later.
Like Shane call that 1,000,000 times, and
this is what I want you to do. Call it now.
The thing is about now, though, we do experience extremely high traffic when we're on this radio show, because we're reminding persons of the numbers. And I'm actually in communication with the team as we speak, and the calls they're back to back and they're overlapping.
Right. So the number again is
536-4800, 7 a.m. to 7 p.m. But if they're on one call, it's one agent at a time. So if they're on one call, they try to finish that call and then on to the next.
Yeah. So don't be daunted, right? Don't be disheartened if you call and they get through. Call again. Yeah.
Okay.
We can answer that phone for sure.
Okay. Thank you, Mrs. Seeley, I guess.
You are welcome.
Do share a lot of love for Valentine.
Thank you.
I have two families in this month. One is just before Valentine, the 13th, and one is just after Valentine. So I have a lot of love to share.
Lovely.
Have a nice day, everyone.
Thank you as well. We gathering, so
okay, yeah, we
gathering with love. We really want to thank everyone for calling today. Very, very quickly, final words from you, Dr. Cruickshank.
I just want to encourage everybody. Yes, we see emergencies in the A&E, but if you're uncertain, call Dr. Corbin-Harte and her team at the PALS desk. They will advise you on the correct place to go.
Yes, the team is definitely they're definitely quite knowledgeable and willing to help. We go through each person. It may take a little time to get back to you, but we're here to help.
Thank you very much for tuning in to the restart of Season 3 of the Pulse Radio Show. I'm Shane Seeley signing off for today's edition. We'll see you next week, 11 a.m. right here on Q100.7 FM.
The Pulse Radio Show was brought to you with the kind compliments of MedSafe Medical Supplies.
For all your medical supply needs, visit MedSafe Medical Supplies Limited. We offer a wide range of products including wheelchairs, walkers, canes, crutches, blood pressure machines, stethoscopes, and so much more. Conveniently located on Gemmetts Lane, just a 2-minute walk from the Queen Elizabeth Hospital. And for your convenience, we deliver free to the QEH. Open Monday to Saturday, 8:30 a.m. to 5:30 p.m. Call us at 624-7542. MedSafe Medical Supplies Limited, your trusted source for medical essentials.